And our goal here is to build collaboration, so when we have issues that come to our city, that we're not having to address issue by issue, that we have a group of people that we can work with, that we can call upon, and say, this is meaningful to us, this affects us,
I just want to just briefly give you an overview of how this organization came forward and how we, when we got our federally qualified health center status. If you hear the acronym FQHC, that's what that stands for, federally qualified health center status. I was serving on the board with public health, and I've been with the organization for over 10 years with public health and total health care. And I was serving on the board with the Public Health Center, and the executive director each month would come to us and say, you know, we have funds that are being pulled from the state. We're going to have to stop. We're going to have to close down this program. We're not going to be able to do this for the citizens. And as a board, we struggled with the fact that we're in a city that have people that need health care drastically. And then we found out that we are in a city, Smith County is one of the 200 poorest counties in the nation.
Overwhelmed by the number of new patients still coming to see us from Athens, Gun Barrel City, Mineola, some from Dallas who were coming to live with their parents, Jacksonville, just all over. So this is not just a Smith County or Tyler region needs that we are meeting. We have patients that come to see us who have no other place to go. You may be familiar with the Bethesda Clinic. Even their restrictions prohibit some patients from continuing their care there. And when some of these patients cannot prove employment or have lost their jobs, they have nowhere else to go but the Total Healthcare Center. We have patients that are recently released from incarceration. They have no place else to go but the Total Healthcare Center. We have patients that wind up in the emergency room and diagnosed with diabetes and other conditions for the very first time. We haven't been seeing a private doctor or a regular doctor. And where do you think they send them? They send them to Total Healthcare Center because they have no other place to go. It would grieve me to the deepest part of my heart if anything happened to this clinic. And I'm telling you, the community would suffer greatly. The emergency rooms would be overwhelmed with the complications of the disease processes not being met on a timely manner on a day-to-day basis that we do here at the clinic. So I too echo everyone's gratitude for your support this evening. It really does bring joy to see that we have a common bond and that we care for these people, and I'm just glad to be part of it.
Was asked, what can we do to help Total Health Care? What will you do? Are you ready to do anything?
That's a good question.
Many times we have done settle this problem here in the city, but it seems like we have people that are not afraid to face the issue when it rises. So you have to speak to your problem, or speak the truth and tell the truth. Call it what it is. My question here, that we did support Total Health Care by help getting a $300,000 grant. And I pledge you tonight that we will continuously do that. But we also will monitor the activities that are going on between the concerned citizens and Total Health Care. I'm getting kind of old and slow, but I'm going to make sure that we know we do the right thing. And we want to do justice for everybody.
Okay, my name is ELOYCE Green. First of all, I would like to thank each of you from Total Healthcare Center coming tonight to give to us this important information, because it has made us aware of what you are doing and that we were not aware of, and we do truly thank you for this input. Second, from listening to you, I understand that you get funding from the state and the federal government. From reading the newspaper, I understand that the city has stopped your funding, so I want to know if the other two entities, the state or the federal, have they stopped your funding? If not, why has the city stopped your funding?
Yes, it's true. We get, in addition to the funding we were getting from the city, we get funding from the state, Department of State Health Services. We get over $1 million from them, and we get funding from the federal government. No, they have not stopped our services. And even though one of the reasons in the letter that the city gave that they stopped our funding because of conditions that we had with the federal government, and then settling because we don't have a CEO in place. The federal government knows that also. And conditions all over the country. When someone comes into to a site visit with you, they find conditions. And we had 3 conditions that are outstanding. We submitted the responses to those conditions in December of 2011. And they have not stopped our fundings. And if those conditions were so serious, you better believe they would have addressed them before then.
Anytime an audit is done anywhere, I don't know if we have any auditors in the House, but many of us have been audited. You're going to have conditions. There are going to be things that are wrong, and all of them are going to end.
Again, like she said, I'm Ms. Lee, community member. Dr. Webster, this question is to you. It is our understanding that the entire city council voted for you guys to have funding for the beginning of the fiscal year. Did the entire city council vote for you not to have funding? And if so, if there are any city council member here to answer that question?
Well, I do know that the entire council voted because I do know that the entire council voted, and they voted for numerous organizations, 501c3 organizations in town to get grant funding. And that was done at the beginning of the fiscal year. And what has happened in the past is that we've had a contract. The $265,000 has been in a contract, and we were paid quarterly. This time, we did not sign a contract. We were told that we would get it monthly. There are 2 council persons here. I can't say, I don't know, I haven't seen it on the agenda where they voted to suspend the money. Either one of the council persons want to speak to that? Donald, we're in your district. You might want to speak to that.
I am proud to be City Councilman of District 2, West District of Tyler, where Total Healthcare is located. I've had the privilege to be in several meetings with the board, city staff, and some of the clinic staff. The council did approve funding for the Total Healthcare. Council has not approved or been involved in a decision to cut the funding.